So I want to just tell you what our plan is for today. What we're covering today is we're going to dig in more to the participation in the SASH program. And we're specifically going to dig into the forms that you're going to sit down with potential participants and walk them through and have them execute, hopefully. So we're really going to get into those so that you get to a point where you're really comfortable with what the language is in those legal forms and how to explain it. But before we dig into that, I do want to take some time just to review some of the basics of participation in SASH. And what I mean by that is the funding sources, who can participate, what is a SASH panel, what do we mean by that, how do you build one, that kind of thing. And I always forget, I like to do pop quizzes. So, so I will have some pop quiz questions throughout this, and so I'm going to start off with one right now. And so my question is, so we're talking about the basics of participation in SASH, and so who can tell me what module in the SASH operating manual covers the participation in SASH, the basics? I will hold you in suspense no further. It's Module 9 of the operating manual, and I say that right up front because I want you to know that that is where you should go. And you should spend some time with, you should spend time in all those modules, but really there's a reality check here, and that is that, this whole thing is a process, and there's a lot to learn, and we know that, and so you need to spend time on modules at appropriate times. And there's no more appropriate time for you to sit down with Module 9 than right now. So really spend some time with that. You're going to see that what we talk about today is all covered in there. And these are not long modules. They're anywhere from 2 pages to 4, I think is the max. So Module 9 is where you want to go to for reference for this training, basically. So I wanted to start off with this slide, which I know you guys saw when we had our kickoff training, but it's really an important slide for this topic because where you guys are in the process is that you're just, for the most part, you're just starting to meet potential participants. You're starting to discuss SASH and what it can do for people, and you're going to be talking to them about these legal documents. And this is where you set the stage for how SASH feels for these folks. And SASH needs to feel person-centered. And you start that from the very beginning. And since this is the beginning, we wanted to remind you about this. So my point here is that this is your first chance to really do this person-centeredness that we talk about. And because when you're sitting down with people and you're walking through these legal forms, your focus on explaining it clearly, thoroughly, being available to them for their questions, you doing that is you being person-centered. So do it right from the beginning because that sets the tone and that makes them comfortable knowing that they're being heard, that you're taking the time to sit down and explain things. So this is not about, I just need to get these legal forms signed, so I'm going to put them in people's mailboxes and see how many return them. That would not be in the person-centered category. So I just want to start off with that. We want Katie to be in the driver's seat, and the only way we're going to do that is if she really is educated about what SASH can and can't do for her, what these legal forms mean, and that her questions are answered. And, the truth is, there's going to be times you're going to get questions that you can't answer, and that's okay, too, because you just say, I'm going to find out and I'll get back to you. But, so just point is start off in the very beginning, keeping Katie in the driver's seat. Okay, so as I said, I wanted to just review some of these basics about participation in SASH. So, again, it's important for you all to understand that SASH is funded primarily through the Medicare demonstration program, which is called the Multi-Payer Advanced Primary Care Practice Demonstration, MAPCP. It's not important for you to know what MAPCP stands for, but it is important for you to know that Medicare funding is the primary source of funding. But SASH participants also get funded through housing organizations that are hosting SASH sites. They a lot of times have existing revenues that they're putting into their services program of SASH, or they have other grant resources that they're putting in to pay for SASH. So there's really these two funding sources for SASH. And so what I want to just briefly go over again is that first category, which is the Medicare MAPCP demonstration funds, and who does that fund? So you know, hopefully it's obvious to you that it funds Medicare beneficiaries because it's Medicare funding, and that's the only folks that funding source can fund. So that's why, for the most part, the majority of your panels are going to be made up of Medicare beneficiaries. And those are people that are 65 or older or adults with disabilities. And so there's two categories here because they're both Medicare beneficiaries, but as we also talked about at the kickoff training, you're going to have Medicare beneficiaries that live in the SASH hub site. Just clear that over there. Who live in a SASH hub, and then you're going to have beneficiaries that live outside of that congregate hub. So it's important to realize that we're not just talking about those people that live in the housing organization's building that you might be working from. Now, this rollout group is interesting because you're actually pretty diverse as far as the types of panels that have started up, because we have panels in this rollout quarter that actually don't have a SASH hub site at all. So you don't have a Grand Way Commons that you're going into every day, and that you're pulling most of your participants from the apartment. So we have a couple that are purely community-based, and so some of you are actually going to be working out of a non-housing kind of office space, which is different and new for us, actually. It's kind of a new area we're going into as we get to those more rural parts of the state that don't have a lot of congregate hub sites. So we have that, and then we have more traditional panels where it's one building that's pretty much going to make up most of the panel. But then we have, in the Northeast Kingdom, we have a SASH panel that's drawing from 7 different hub sites because those are much smaller congregate buildings. So it's really quite a diversity in this group, which is exciting, and they all bring different challenges for you all. But key is Medicare funding primarily through this demonstration, and again, we're funding the Medicare beneficiaries who happen to live in the SASH hub site and those that live out in the community, either in private apartments, single-family homes, mobile homes, whatever it is. So I have my next quiz question. So I talk about panels. I just said the word panel. So who can tell me how many participants make up a panel? 100? Yay! Okay, so yes. So the Medicare funds that come to us through the demonstration come in for basically panels, and the panel size is 100. We also, though, fund half panels. And we have a number of you are half panels this time around, so 50. And what's important about that concept is that, it's not that we're not billing Medicare in a traditional way for the SASH services we're providing. This is really, the reason it's called a demonstration is because Medicare is saying, you know what, let's demonstrate a different way of paying for something. And the way we're going to do that is we're going to provide this kind of capitated bulk payment to the state of Vermont, and they're going to use these fundings per panel to provide these SASH services. So that's why you guys don't have to be bothered with billing, Medicare for every, 10 minutes you spend with a person doing care coordination or their time talking about them in a team meeting. So this is is truly about healthcare reform and payment reform, because it's Medicare saying, you know what, we're going to try this out and see if it actually, saves money and provides better care and services. Okay, then just quickly, I said the other funding for SASH is existing revenue sources and grant funds that a housing organization that is providing SASH brings to the table. And these funds are used primarily for those residents in a SASH hub site, like Grandway Commons. I'll just use that as an example because that's where I am. We have some participants here at Grandway Commons, residents that live here, that are not Medicare eligible. We're a building that is available to people 55 years and older. So we have people in between 55 and 65 that are not Medicare, but we still provide them with SASH. And we do that because we have traditionally put revenue from our operations into services here at Cathedral Square, and many other housing organizations around the state do that, some of which you guys are employed by. And there's also other grant funding sources that a lot of housing organizations have gotten through the years, and these include, I just note these, HOS grants, which is a state grant-funded opportunity. ROS is a federal grant that a number of public housing authorities have, and then Housing and Urban Development has resident services grants. So there is a way to provide SASH to people that aren't Medicare eligible if your housing organization is either providing funding from existing revenue from operations or through some of these other grant sources. Questions on that? Okay. I wanted to just give an example of how it can really look in the real world when you guys are out there trying to figure out what your makeup of your SASH panel is going to be. Because as I just mentioned, you're going to have primarily Medicare beneficiaries, but in a lot of cases it won't exclusively be Medicare. And you have to think through this right from the beginning. So I try to just come up with an example here. And so I want to walk you through this. So in this situation, the housing organization said, we want to start up a half panel in our, this is a real panel somewhere, I can't remember where, but we want a half panel. So we said, okay, so we're going to pull down a half panel from Medicare. And what they had was a housing congregate site that had 24 residents living there. So what they knew right away is that they were going to have to serve more than just those 24 residents. They obviously knew they were going to have to go out into the community. But what they didn't know was how many community participants they were going to need, because you have to know not only how many residents are in your congregate housing hub site, but how many of those are Medicare. Because at the end of the day, if we're pulling down half a panel of Medicare resources for you, at the end of the day, you're going to have 50 Medicare beneficiaries at some point. There's no magic time frame for when you have to have that. It's not like 30 days after you start SASH, you have to have your 50 or 100. It's not even 6 months. The truth is, for some of our panels, it's taken over a year to grow to that 100 number. But what you need to understand is that you do have to get to that number eventually, and you're going to have to look to community participants to make up the difference if you have less, if the total of your residents in your congregate site does not include all Medicare beneficiaries. So let me just finish. I think I'm sounding confusing. So let me just finish my example. That way I think it'll be clearer. So in this situation, the housing organization had 24 residents in their congregate site, and what they found out is that 19 of those 24 were Medicare beneficiaries. So instead of having Medicare to cover all 24 of those residents, they're only going to get Medicare to cover 19. So that meant, do the math, they had 19, they had to eventually get 50, so they needed 31 community participants. So 31 and 19 gives you the 50. Now, what we know, though, is that they had 24 residents. So what about those other 5? So we know that those other 5 are non-Medicare. And in this particular situation, the housing organization had has a HAAS grant to the state of about $7,000 a year. And so they decided that absolutely they were going to offer SASH to everybody, all 24 residents, because they could make up the difference. And so the other thing I think we mentioned at the kickoff training is that currently the amount of funding we get from Medicare for a full panel is $70,000 per year. It comes to, so it breaks down to $700 per participant per year. So that's, you know, roughly what it costs, although we know it's a little bit under. But what that means is for those 5 non-Medicare, if you say it's $700 per year, you know, 700 times 5 is $3,500. So that's what the housing organization had to come up with of their own resources or another grant resource to make sure they could provide SASH to their entire building, even those that aren't Medicare. So that's something that you all want to make sure when you're starting starting to grow your panel, that you really know what you're reaching for. You know, what is my, you know, how many of my residents are Medicare? So so once you know that, you know, do I need to reach out to the community? How much do I need to reach out to the community? And then talk to your, you know, leadership at your housing organization to find out, you know, are we able, so let's say we have 5 people in our congregate building that aren't Medicare, can I plan to offer it to all of them? So those are just important discussions you want to make sure that you're having early on. Now, for those of you that are in community-only panels, it's simpler in a way because every participant you have has to be Medicare eligible. That's just how we set it up. If you're not in a SASH housing hub site where you have really quick and easy access to SASH staff, you just have to be a Medicare beneficiary. So any community participants in the community panel, you don't have to go through this process. You just know if you're opening up a half panel in the community, you're going to get 50 Medicare. If it's 100, it's 100. So that might be the only thing that's simpler for you in the community panels. So as we talked about, SASH is this kind of spectrum of supports and services. And depending on the participants' desires, needs, circumstances, they will kind of take what they need, want, kind of off of this list. And there's a point, though, on this continuum where we're getting into the types of supports and services that require the participant to sign these legal forms. And the reason for that is because we're starting to deal with you know, potentially protected health information, sharing of information between providers, just starting to get into some of those more robust forms of coordination and support. So, you know, again, this is just making the point that there are some very, what we call basically an automatic benefit, which are the lower ones here, that, you know, that do not require, that don't require the full legal forms to be filled out. But those are, you know, pretty basic things. It's one-on-one, you know, referrals by the coordinator. It's, you know, participating in some of the community healthy living plan programming. But it doesn't include the type of, you know, action planning and real focused coordination and support that a person will need when their health and functional status changes. So the ones that are kind of further up the line are the types of activities that require the forms to be filled out. Now, all that said, my direction to you is that you consider when you're first talking to people about participation that, you know, what you really want to do is get everybody to sign the forms, because what that allows is for the potential for you to provide the more robust services and supports that are going to allow them to stay home safely and to you know, improve their quality of life and to save Medicare funds and health care funds down the line. And so you really want to go into it with that attitude that, you know, the full benefit of the program is really what makes sense for everybody, because they get to pick and choose what they want of the program no matter what. Again, they're in the driver's seat. So even though they sign the forms that we're going to go over, it doesn't mean they have to go to any evidence-based program we do. It doesn't mean that they're going to be talked about at a SASH team meeting. It doesn't mean that we're going to provide transitional discharge support from a hospital. That all depends on whether they want us to do that. But without these forms signed and these consents, then if we don't have those, there's no chance that we can get started on that. So you want to start with the premise that, get people to sign up for the full benefit so that it's available to them at any point. So we're going to talk about these 4 SASH documents that you're going to be getting your potential participants to understand. Only 2 of these forms need to be signed, and the other 2 you just need to review with them. One of the forms has to be re-signed every year, so we'll talk about that as well. So the next thing I want to do is show you where you find these. Who can tell me where you might go?
The SASH website.
The SASH website, yes. So these forms are kept in the operations manual, which is on the SASH website in the forum. So you go to the SASH website, as I said, sashvt.org, and you guys should all have that as a favorite on your favorites bar. If you don't know how to do that, ask someone, one of your colleagues that will know how. Don't ask me. But okay, so at the SASH website, you go to SASH resources, and then you go to the SASH forum. And this is where you will go as SASH staff for basically any information around SASH. So if you have a question about a material or a policy or anything SASH related, go here and just look around, because my bet is that it's going to be here. So the forum includes a section on information and resources, which guess what? That's where you're going to find the SASH operating manual, which is right here. Now, my next quiz question is coming up. Okay, so you hit that, and you open up operating manual. Look, 154 people have viewed it. That's impressive. Okay, so when you guys go into this, it'll ask you, this is a password protected section, because we don't want the SASH operating manual out there for anybody in the world to see, because we could all of a sudden start dealing with copycat programs around the nation. So there is, that when you guys do this, you will see there is a requirement you put in the SASH, a password. So who can tell me what the password is? SASH user? SASH user. Well done. Who is that?
That was Nerdy Annie.
Oh, Annie. A+. All right, yes, so so not caps or anything, it's just SASH user. Okay, so that brings you to the module. And if you remember, we talked about the first quiz question, module 9 here is participating in SASH. So that is where you want to go to review this kind of information. So this is where we're gonna go to module 9. There's a couple different places to get to these forms, so I decided to start here. So we go to module 9. Here is module 9. You'll recognize some of this stuff. Okay. Okay, and in this module it gets down to talking about full benefit participation in SASH and what you have to, what the forms are that you have to utilize. And as I mentioned, there are 4 forms, and these are all here. And what's cool is that the blue writing means that it is a link. So we're going to pull up the first form that you're going to go over with your potential participants, and that's the explanation of SASH benefits. The first form I want to talk with you guys about is the explanation of SASH benefits. And this is what we've heard from SASH coordinators, existing ones, is that this is really the best form to start with when you're meeting with your potential participants. And the reason for that is because guess what? Explain. SASH, hence the title. So it really walks through with the potential participant what SASH is all about and what not only will they get from it, but also what we will provide, that it really is a two-way street. So the first thing I want to let you know is that these are fill-in-the-blank forms. So you guys need to, for each of your panels, you need to go in, pull these forms, and then save them as Word documents, and then fill in the blank. So what I mean by that is it kicks off right at the beginning that you see here, name of SASH site, SASH. So I'm at Grandway, and the name of the panel here is Grandway. So we would fill in Grandway SASH. And then you go down to the first paragraph, and what this provides is just a very simple, it's really that kind of one-sentence description that we talked about at the kickoff training about what SASH is. And it explains that SASH is this partnership. It's not just this housing program. It's not just your housing staff. It's a partnership of a number of organizations. So what you guys need to do before you're meeting with these potential participants is have these blanks filled in. So you will fill in the name of the housing organization that you work for. That's the housing host. You'll fill in the name of the home health agency, the area agency on aging, the mental health agency, and then any other partners that are part of your partnership. Now, people ask, well, how do I know who those organizations are? And that's a great question. And the way you know is that you ask for the SASH Memorandum of Understanding that is in place in your region, of which your panel is part of that. So you will want to ask your supervisor if you don't already have a copy of the MOU. And if for some reason your supervisor doesn't know, which is possible, and that's okay, then you want to have your supervisor or yourself contact the designated regional housing organization that has provided support to get SASH started where you are. So that's the DROs, and I think we talked about that at the kickoff. There's 6 designated regional housing organizations around the state that have worked with your housing organization. And some of you work for housing organizations that are DROs, that are the designated agency. And they will have a copy of the Memorandum of Understanding. So you'll want to have that so that you can then make sure you're filling in the correct names of the organizations. So you want to get a hold of that SASH Memorandum of Understanding. And if you're really having trouble finding this, just call us. We will make sure you get your MOU. So, okay, so you fill in those blanks, and then this really walks through, we think, pretty clearly, with the participant, what does SASH provide? So, I'm not going to read this word by word, but and I would not suggest that you do that either when you're talking with your participant. But you should be comfortable enough with this form that you can kind of summarize what these 2 paragraphs are saying. So you're going to want to spend some time with it. It gets into some more details later on where it says, to receive the full benefits of SASH, here's what you have to do, potential participant. And you may want to read or, just go through these 1 through, maybe it's 8. So basically the potential participant they want to get the full benefits of SASH. They have to consent to this release of information. They have to waive claims, and we're going to get to that form next. They're going to participate in the SASH assessment. They're going to participate in developing what we call the Healthy Living Plan, and it goes on and on. So this makes it clear to them what it means to fully participate in SASH. One important, they're all important. Number 7, I think, is something that you really want to emphasize with your potential participants, is that we really need them to keep us informed of any planned hospitalizations or nursing home stays, because we don't have a perfect system in place yet to know when somebody is hospitalized. We're making lots of progress in that all over the state, but until then, we really depend on them to be really open and tell us ahead of time if at all possible. Obviously, if it's an unplanned hospitalization, that's different, and then they want to let us know as soon as possible thereafter. But a lot of folks have planned surgeries, things like that, and if we know ahead of time, you guys can start doing the important work of making sure they can stay home safely upon return. Number 8, I just want to point out as well, because this is going to play into the waiver form that we're going to talk about. This makes it clear to them that they as SASH participants will still be responsible, to have their own health care providers. SASH is not becoming their primary care doc. They still choose their own health care providers. They still make their own health care decisions. So that's an important point to make as you go through this form. The next section in this explanation of benefits tells the participant what the SASH partners are agreeing to do as part of this program. And again, it's a pretty basic list, but we're gonna do a SASH assessment. We're going to maintain this directory of evidence-based programs that they'll be able to participate in. Number 3 talks about the fact that we're going to protect their confidentiality. We're going to follow the HIPAA laws, and we'll talk more about that in a minute. We're going to develop these healthy living plans. So it really lays out for them what the partners are agreeing to do through this. And then the next part of this form just tells them, okay, what's next? So at this point, you're gonna pretty much know this person is interested in participating. So you say, okay, so let's talk about what the next steps are. And I like how this lays it out, because I think it's important for the person to understand. So I understand basically what it is, but what does this mean for me in the near future? So it's pretty specific, and it says, we're going to review and we're going to sign these 2 forms. We're going to schedule you an assessment. We're going to develop a healthy living plan. And these are basically in order. So, number 1, we're going to sign these legal documents. Number 2, we're going to schedule you for an assessment. And number 3, we're going to get you going on a healthy living plan. So that's kind of like the, next things that are coming down the line, which we have found that people really like to know. And then the last 2 sections here on this explanation is, one section is about fees, because people always ask us, what's it going to cost me? And this makes it clear that there are no fees associated with this, with participating in SASH. So it doesn't cost anything to have the assessment done, to develop this healthy living plan, to have the team meetings happen where we're doing this action planning and care coordination. The wellness nurse supports are free of charge, all that. But it does make the point that if there are some special services that are kind of discussed at a team meeting and are something that the team thinks could be helpful to the participant, those kind of things would be explained to the participant, but that's completely their choice whether or not to do that. So an example of this is, foot care or a personal care attendant. These are things that, they'd have to pay for, and they're not provided by SASH staff. But it could be that the SASH team has said, based on your situation, we want to tell you that, having a personal care attendant help you out for the next few weeks as you're getting home from the hospital for a day or 2 a week, would probably be really helpful. And, here's some numbers to call to research information on that, or we can help do that. So those kinds of services, they'd have to pay on their own. And then lastly, the last paragraph here makes it clear that SASH is a voluntary opportunity. Just because you live in a housing site where SASH is available doesn't mean you have to participate. And that if you no longer choose to share personal health information, those are things you can just talk to your coordinator about, and we can make the changes that need to happen. So it's important that people realize that it's really up to them, not only whether they participate, but then how they participate. Because the truth is, you're going to get some people that are willing to participate, but then when it gets to the point of you wanting to do the next step, which is develop a healthy living plan with them, they may say, you know what, I'm just not I'm not feeling that. You know, I'm busy for the next 6 months, or I'm doing this, and I'm not interested in developing that. And, you know, that's okay. They're in the driver's seat. That doesn't mean that you're not going to check in with them later to say, hey, you know, do you want to set some goals now? Do you want to talk about that? But they're not required to do anything in here. You know, we believe fully that if we do the steps that are in here, that makes the biggest impact. But again, they have to decide on their own that it's something that they want to do. So I hope that makes sense. And then lastly, it makes it clear to them that if for some reason the SASH funding through the Medicare demonstration is not continued, then we can't continue to offer SASH. So we have to have that language so they understand that we are contingent upon this Medicare funding. So if that ends, we're in a totally different ballgame then. So, all right. Any questions on that? So again, there's no signature required here. This is just explaining to them what the program benefits are. Now, what you'll find, I know Nina is on the phone, an existing SASH coordinator. I think what you'll find is that some potential participants really want to dig into some of these details. Others are going to be like, oh, please, like, whatever, just, summarize this. So you really have to kind of figure out kind of what you're dealing with as far as what the person's looking for as far as the explanation goes. I would always, I'd rather fall down on being too informative and letting them kind of say, I got it, and let's move this along, or try to look at body language and decide. Nina, do you have any? Not to put you on the spot, but what the heck? Do you have any thoughts to share on that about how it's different depending on who you're meeting with?
This is Diana, and actually Nina stepped out for a moment, so she will be right back. But
okay, no, that's fine. That's fine. I just thought, since I thought she was there, that I'd see if she had anything to add. But
I'm curious, what about like Emily or Janet? People have been here for, can't remember, a month or two. Have you had experience, or what's your reaction to people who are fairly new but might have had to do this with some folks? Do you have anything to share on that?
I think Molly's right. This is Janet. It really depends on the person. I've even had family members who wanted to look over the paperwork for a day or two and then get back to me. So, and then I've had people that just say, give me the papers, and I have to push to make sure that they do understand. So I think you just meet people where they are.
Yeah, that's great. And Janet, thank you for mentioning family, because that's on one of my notes here, and I haven't mentioned that. But you want to absolutely, when you're setting up the time to meet with a person to go over these forms, ask them very clearly, would you like a family member or support person or a friend with you when I go through these forms? And absolutely schedule the time according to when that person's family or a friend can be there if that's their wish, because that is extremely important. And you're going to definitely have some participants that have some cognitive deficiencies potentially. So, really, and just as a standard, of course, ask that with everybody. When we meet, would you like to have family involved? And let's make sure we schedule at a time when that works for everybody. So that's great. And I agree, Janet. I've gotten calls from family members to kind of ask some very specific questions sometimes. So you'll definitely find, especially when you have a family member, son or daughter that's a lawyer.
Yeah.
Those are the calls I end up getting. So that will happen. And as we dig into the next forums, you'll know why. So anything else about the explanation of program benefits?
What if somebody really doesn't understand? Or, maybe it's like really kind of
right.
issue like that.
So just in case you guys didn't hear that, Amy asked, what if there is somebody who really doesn't understand, or there's a cognitive deficiency? So I guess my first thing to say is that can be really hard to tell, especially when you're at this point where you don't know whether they have dementia, or that you haven't done an assessment, so you haven't been able to figure out if they have Alzheimer's, whatever. So even though it may seem really obvious, you don't know for sure. So but I think in that situation, you would really push to have their family members or support persons there, and that's what I would recommend. And if that person really isn't getting that, isn't even understanding how to reach out to their family or something, then you want to talk to your supervisor or talk to us, and we'll come up with a game plan. But in those situations where you have any inkling that that's going on, really emphasize that let's schedule a time when whatever, your son can be here or your daughter, and then I would hopefully they'd give you permission to call their daughter or son to have and you could say I can call your daughter and set that up if that works for you. And I think for the most part that isn't an issue. Do you have anything to add, Stephanie?
No, I mean, it's just some people may have a power of attorney for signing paperwork, or a legal guardian by the state if they've had developmental delays their whole life, someone who helps sign paperwork. And so it's just different ways. If you're talking to them and you're feeling like they're really not understanding the thing, you don't feel comfortable with them signing it, I think it's okay just to talk to them about that and ask those questions. That's kind of what Molly said. And yeah, hopefully a person at least has someone in their life who is around when they sign financial or legal documents, that if you're feeling like they're not very comfortable, or not understanding that, you could say, let's figure out who that person is for you. And
the next form I want to talk to you about is the waiver and release template. Okay, open. Again, go down to your Word, and it should be right there. There it is. Nice. Okay. Again, it's a fill in the blanks type of thing. So again, you want to, right when you get started, get these things filled out and then have your kind of master copy saved somewhere in your well, for Cathedral Square, it's probably in the S drive, but in other organizations, it's whatever that drive is called.
We have a shared drive. That's what S stands for, share. Most companies have a shared drive. You may have it just on your computer, but shared is often better.
Right. So, okay, so the waiver and release form, it does have to be signed by the participant, and this is a form that makes it clear to the participants that, as I mentioned earlier, that SASH is not a health care program, and that we're not going to be providing them their medical care, their health care, that's what the very first sentence is, that they understand that SASH is not doing that. And that's very important, because what we're asking the participant to do when they sign this form is to waive any right to sue or hold liable the partners to the SASH collaborative. And remember that those partners include the housing organizations that you work for, the home health agency, the area agency on aging, the mental health agency. So those are who the SASH partners are. And you might say, well, at least the home health agency, they are a healthcare provider. So why would we require our participants to waive their ability to sue a healthcare provider when they do provide healthcare? And that's where it gets tricky to explain. But I am going to share with you a situation, and I think it's going to make it clear to you. So in the SASH model, when the partners come together, when the partners are coming together, they're coming together to provide care coordination, action planning, knowledge sharing. The SASH partners, when they're acting in their SASH capacity, they are absolutely not providing health care services. That doesn't mean that a SASH participant that you have could not have a separate relationship with the home health agency, the VNA, to provide skilled nursing when they're coming home from the hospital, or maybe they're getting help because of a fall risk. They can still have a private relationship with that home health organization, but when they're in that relationship, that organization is not acting within their SASH parameters. And I know that sounds confusing, but I'm going to make it clear in a second. But it's important for you guys to understand that when the organizations come together to do SASH, when they're in that official capacity as a SASH partner, they are not providing health care. That doesn't mean that they can't have a separate relationship where indeed they are providing health care, but those are two very separate what am I trying to say here? Functions, two separate functions. So I'm going to give you an example. So you have a SASH team, and let's say you're at a SASH team meeting, and you're talking about a participant that has been falling a lot, okay? And the whole SASH team is together. That includes the skilled nurse from home health, the case manager from the AAA, you, the coordinator, the wellness nurse, the elder care clinician. And so you're talking about Mary, and she's been falling a lot. And the VNA, the home health nurse, says, as part of her role in the SASH team, hey, you know, it might be good for Mary to get some physical therapy because, you know, that could potentially really help her to not fall again. So the home health nurse is providing that information as part of her role on the SASH team. So, you know, the team goes, you know, that's a great idea. So the SASH coordinator says, you know, I will follow up with Mary, the participant, and say, you know, hey, we talked about the issue with you falling a lot, and, you know, we, as a team, we recommend that, you know, maybe we set you up with a physical therapist to come see you and work on, you know, whatever the issues are. So the participant says, oh, that'd be great. So PT, physical therapist, comes in, starts working with the participant, and, you know, let's just say something goes awry, and the participant ends up being hurt by something, you know, allegedly. The participant says, you know, oh, I'm hurt because of that physical therapy exercise that physical therapist had me do. So let's say they sustained some kind of injury. So in that situation, the participant can absolutely pursue a claim against the physical therapist that works for the home health agency of which they have a separate relationship with to provide this physical therapy. Because believe you me, home health physical therapist is not going in there to do physical therapy with a participant, with a participant, unless they've, you know, that participant has signed a contract that says, yes, I'm going to get physical therapy services from you, and this is how you're going to bill for it. It's probably going to be billed, you know, through traditional Medicare. So that participant can absolutely go ahead and you know, contact a lawyer and start proceedings to sue the home health agency because of this alleged claim because of a physical therapy issue. So that's fine. What that participant can't do once they sign this waiver and release is say, hey, you know, the only reason that I even knew about contacting a physical therapist is because the SASH coordinator who works for Cathedral Square told me about it, and I heard it was the home health nurse that sits on that SASH team that brought it up in the first place. So, you know, my lawyer is so smart that we're now going to go after everybody's pocket that had anything to do with me eventually seeing the physical therapist. No, 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 no. By signing the waiver, what that person is agreeing to is to say, I'm going to hold those organizations harmless when they're acting in a SASH capacity, which is only about sharing information, making suggestions. It's not doing the health care. It's not doing the physical therapy. But importantly, it doesn't take away that participant's ability to sue a healthcare provider, even if that healthcare provider is part of SASH, if they were in a separate relationship to provide actual health care services. So it's okay for the SASH partners, when they come to this team meeting, to share information that may then be shared with the participant who may act on it and decide to see a physical therapist. And if something goes wrong, what can't happen is the participant can't then go back and hold everybody accountable for that. And the fact of the matter is, if we didn't have a form like this, and we didn't have participants waiving this right to sue, these partners would never have agreed to come together and work as this SASH partnership collaborative. Because, I mean, if we, Cathedral Square, thought we could be held liable anytime a SASH participant has a separate relationship for home health services or mental health services from other partners, there's no way we ever would have done this. So that's what this form is protecting the SASH partners from. It's not protecting a SASH partner from, a real, a negligent act in a separate healthcare provider relationship. So I don't know if I've beat that enough, but it is the one form that has caused the most questions. And let me just preface by saying that that's probably added up to about 5 questions in total since we started SASH. So it's not even very many. And I laugh because I've gone to our attorney, basically 4 of those 5 times to say, oh, we got a question about this. Maybe this should be rewritten. And she's always said, how long have you been doing this? And that's all the questions you've had. Like, the fact of the matter is, it is a complicated thing to look at and read. And it is like that because it has to be set up so that there aren't big loopholes that a good attorney will get through and hold all the SASH partners liable for something that I just described with the physical therapist. So, when you talk about, legalese, this is it. This has those legal words, and, depending on the participant you're talking to, some are just going to be like, oh, I know, it's that legal mumbo-jumbo, and they'll just sign it. Others, are going to say, like, oh, I'm confused by that. And when they say that, use the example I just used with you to say, you can still sue somebody in a, if you have a relationship for the healthcare service, but you can't sue everybody else because we happen to share the information that maybe you should get that. So I think it's helpful to have a example in your mind. So that's why I share that. So questions about that? I'm showing you another place where you can find these because there's the tools and resources section in the operations manual. So right here is where you click for the operations manual that opens up, all the different modules. The right below it is the tools and resources. So everything that's mentioned in the operating manual is listed separately. So the next one I wanted to show you is the authorization for use and disclosure. So that's right here. So I'm going to open that up. Okay. And this one is pretty simple, especially compared to the one I just put you guys through. And what this form does is it explains to the participant that indeed, as part of the SASH model, we are going to be sharing their information, using it and disclosing, which means sharing and providing it to our other partners within the partnership. Excuse me. And again, this is a fill-in-the-blank type of form, so you want to do that right from the beginning. So again, you're going to be putting in the name of your SASH site, and then you're going to be right in that first paragraph talks about that the participant is authorizing the SASH partners, then you need to list them. Your housing host organization, your home health, list them all there. That the participant is authorizing all these organizations to share information, and then it makes it very clear what you're sharing information about and for what purpose. And that is really important because what you want to make clear to the participants is that, we're not just going to share information just because we're bored, because we have nothing better to do. We're going to share information specifically for these purposes, and they're listed right here. Coordinating care and services, facilitating safe transitions home from the hospital, developing a healthy living plan, and developing a community healthy living plan. So it's very specific. So it's not just willy-nilly, like we're all getting together for a team meeting and let's just pick a participant out of a hat and start like sharing it and everything we know. That's not what this is about. So, and I think this form is great because it makes it clear that there are specific purposes. So it gets down into, you actually end up repeating here lower the names of those core SASH partners. And then there's some other folks listed here that they're agreeing to allow the information sharing. And this is very important. So they're also allowing the information sharing with their primary care physician and their staff. And this is really important, for instance, when we're doing medication inventories, and let's say something comes up and the wellness nurse maybe is concerned that there's a couple of medications that could be interacting oddly. We may want to call the physician and double check that. So it would allow offer that. We also might want to follow up with the physician after discharge from a hospital stay, again, to make sure everybody's on the same page. So that includes them. And also the community health teams. Remember, we talked about the fact that SASH is part of the larger blueprint for health, and these medical practices that participate in that have these teams called community health teams that provide additional support. And so you will end up partnering with these folks. And so this use and disclosure allows you to share information freely because they're listed here. And then you're going to be asking on the next line, you're going to ask your participant, okay, so what family members or support persons should we add here that you're willing for us to share information? And you know, and the example to go back to, if they're struggling with why they would want to let you talk to anybody, is to say, you know, let's say you unexpectedly go to the hospital and we need to contact someone about that. We need to talk about what the plans are. You know, who is it that you would want us to talk to? And that usually, boom, like they go, oh, okay, I hadn't thought about that. So that usually opens it up. Others that we have listed here, discharge planners at the hospital, nursing, or rehab facilities. That's very important that that's on here. We have on here the UVM Center on Aging and Health Sciences program. Depending on where you are, you may not want that on yours. We have that because we end up using a lot of students up here, pharmacy students, medical students, nursing students. So this allows this kind of blanket sharing of information. And then there's an additional line here that you can, you know, add others. So there could be, I know in the southern part of the state, the EMT ambulance service in the Brattleboro area is they've added to the use and disclosure so that if somebody's going to the ER, the EMTs feel comfortable talking with the SASH coordinator about that. So there's room to add more, but you know, you want to just go through this with your participant. And then it includes some standard federal language about non-discrimination, civil rights, and there are some, it's important for you to look at this so you realize there are some blanks in here that also need to be filled in. So this requires that the housing organization is going to follow the Civil Rights Act. You have to put in the name of your housing organization. You're not going to discriminate based on race, blah, blah, blah. And then importantly, that you're going to designate a staff person to coordinate efforts around privacy and federal laws. And that's not going to be you, the SASH coordinator. It's very likely going to be, you know, someone in upper management. It might be an executive director of your organization. It might be, you know, I don't know what the different position names are there. But for us at Cathedral Square, it's our chief operating officer who we fill in there, who acts as our privacy officer. So you need to have that discussion as well with your supervisor if you don't know who to put there. And the note down the bottom here, it makes it clear that up above in that first paragraph you have to put a date in, and that's the date that they're signing this authorization for use and disclosure, because this is the form that not only has to be signed now, but has to be updated on an annual basis. So every year you're going to be sitting down with your participant. This is very person-centered to say, you know, let's talk about this. You know, here's who we have that you've agreed to have us share information. Is there anybody you want to change here? Is there anybody you want to take off? So have that discussion. And so our attorney felt very strongly that having this updated every year was really meeting the intent of federal privacy and confidentiality law. You know, there are some that have said to me, I think that's kind of overkill, but to be honest, I'd rather us be overkill, especially when we're housing organizations kind of entering this healthcare arena. We do not want to be accused of not being, not being able to handle, dealing with private information. So this is one way that we make it very clear that we take it seriously. We're going to have a conversation every year with our participant about this and update it and make sure it's current. So this is the other forms. As I said, there's two that have to actually be signed. So it's the waiver and the use and disclosure. All right, any questions on that?
Does this get done every year, even with people who are low participation?
So Amy's question was, do you do this every year, even with people that are getting the kind of automatic or low benefit? And the answer is no, because those people you're actually not signing any of these forms with.
Right, because on that scale, they're
Yeah.
down at the bottom.
Yeah. So if you have a participant that's in your housing organization that has said, you know, I'm interested in, you know, going to some of the programs, but I'm not interested in, you know, the fuller benefits. You're not going to go through any of this with them. You're hopefully going to go through with them why they should.
Yeah.
That there's really, we're not going to require anything different of them. It's just we're going to have everything we need right away in case something does happen. But if they're, you know, and some people will be adamant, they're just not joiners, and they'll say, no, I'm just going to kind of hold back and see how it goes. That's fine, but you won't be going through any of this with them. Have one more form to get through. Okay, and that is the Notice of Privacy Practices. And this is a form that does not need to be signed, but it does have to be provided to the participant. So once they sign the use and disclosure, you're basically going to hand them the Notice of Privacy Practices. And you guys have actually all seen something like this every time you go to your doctor's office and you look at these kind of forms and you sign them. It's all HIPAA, it's all standard HIPAA language, federal confidentiality. Again, fill in the blanks, so you're going to put in your SASH county collaborative name, your SASH panel site right here, so Grandway SASH would be there. And what this notice does is let your participant know, and we cover it. A lot of this stuff is actually covered in that use and disclosure, but it's another statement so they understand that what their rights are and what are our responsibilities about any protected health information that could be shared through this process. So Section A just lets them know these are your rights, that they have a right to receive this notice of privacy practices, that they have the right, they need to understand that we intend to use and share their information on an as-needed basis. They have the right to receive a copy of their health records. So if they're interested in, seeing the assessment information, absolutely, we can figure out how to print off their basic information from their assessment. If they want to see any notes that have been made by the wellness nurse, we can get all that. So they have the ability to ask for this, and we'll get it to them. So it has a number of other things. You just want to walk through that. Then it talks in Section B is about our responsibilities as the SASH partners, and it says that we, and again, you got to fill in the blanks here. You got to put in those partner organizations that the SASH partners agree to basically follow the law. That we're going to accept the responsibility to maintain the privacy of their information. We're going to follow the terms of this notice, and we're going to only use the information for the stated purposes that were in that use and disclosure. Section C tells them these are basically the routine uses and disclosures that we're going to use, and we talked about this in the use and disclosure. We're going to use their information to develop a healthy living plan, to coordinate their care, to facilitate transition. So it just, again, makes it clear this is not willy-nilly sharing of information. It's for these stated purposes. And then Section D is makes it clear to them that there are rare times when without their authorization, we may indeed need to share some of their private information, and then it lists those situations. Again, this would be very rare, and it doesn't say that we have to, but it says we may have to, depending on the situation. So if there's a risk to public health, if there's a criminal action or law enforcement is involved for some reason, so there's these, and this kind of goes through some of those potential scenarios. Again, you want to stress that these kind of things are very rare, but we need to be clear. And then lastly, Section E, these last sections are, makes it clear that we're not going to be selling or releasing their names for any, marketing or fundraising efforts. They can contact their SASH coordinator for any additional information. Again, they can get a copy of their health record. And then Section H is very important. You need to fill in, again, who your privacy officer is. So it would be the name here. And what is number 3? This little footnote. I think it's the address of your housing organization. Yeah. It says insert name of housing host and name and address of the staff person serving as the privacy officer, and then the effective date. So what you want to do is provide this notice to your participant, and then every year when you re-up the authorization for use and disclosure, have this notice with you and give it to them again. Again, it's just good form, good habit to get into, just to remind them that we take HIPAA compliance very seriously, and here's the notice again. Other thing, there have been some new changes in the HIPAA law that really pushes being really open with this notice and putting it up. So if you have a bulletin board at your hub site, fill this out and put it up there. It's on Canadian Square's website. If you have a SASH website, if you have some kind of website for your housing organization that has a section about SASH, put this notice on your website as well. So really get that out there so that people can see it. So that's kind of new, a new requirement. So just to be public with it. So I think that's it. Any questions on that privacy practices notice? Okay. So again, that one does not have to be signed. It just has to be, again, walked through and given to the participant. All right. I think we're almost done. I think we're done.
You guys are awfully quiet.
Yeah.
Chat.
Well, you're welcome to chat, but I also know that this is one of those trainings where it's a lot to take in. But, if we didn't do this, I don't think you guys would take the time to look at it. It's hard to really find the time to look at each document separately and to focus on it. So we really felt, we've messed around with how to do this training. We initially used to try to cover all this in that first kickoff training. I mean, can you imagine? I'm getting this look from Amy like, no, God. So that's why we decided to pull it out so that we actually had a time. And we initially thought we could do it in an hour, and the reality is we've found it takes about an hour and a half. But I hope that you found that helpful, and it's really about you all. We want you guys to feel comfortable, doing this with your first couple people, because the truth is, once you do it with a couple people, it's going to get so much easier. But it's those first couple times, and you'll kind of get your shtick down, and you'll get more comfortable with it. You'll start to get questions, and some of them you'll be able to answer. Some you'll have to come to us to get the answers, but you'll build up your kind of expertise, and it will just get easier. But we don't want to throw you out there and just have you do it the first time without this kind of an overview. So again, look at Module 9. All of this stuff is there. I'm just about to forget. I wanted to show you that we really do have those talking points. So those are here. I think they're right here under the tools and resources. If I were you, I would print these out and just have them kind of in whatever your folder is that has all of your participation forms. So I'm going to go here. Talking points for SASH legal documents. I'm going to open that up. So here it is. So it goes through the authorization for use and disclosure and the waiver and release form. So the two forms that require signatures, this gives you some talking points. So I would just, have this with your stuff, and so when you're meeting with participants, you kind of have that there. And maybe, write in, that example that I used around, physical therapists, just ways for you guys to remember how to share information to make it clearer to the participants.